Another entity I'm going to talk about is the Lobular Capillary Hemangioma, aka Pyogenic Granuloma. So I think the first name is better to characterize, make you remember this entity. So let's see the image. So this is the polypore lesion. You always can see a lot of blood vessel inside. One characteristic feature is this large blood vessel and fitting by this small vessel and then forming this lobular structure. Large vessel, small fitting vessel forming this lobular structure. And then when you sometimes this lesion this tumor you can see is ulcerated surface. And then just want to show you this lobular structure, big vessel fitting by this small vessel forming this lobular structure, really characteristic. Big vessel, small vessel forming this lobular structure. And then in the stroma you can see different kind of mixed inflammatory cells. Show you again, big vessel, small fitting vessel forming this lobular structure, and then some inflammatory cell like lymphocytes, maybe plasma cell, eosinophil, neutrophil, but kind of mixed. Low power, we already know this polypore lesion, and then lobular structure, big vessel, small fitting vessel forming this lobular structure. And then see virtual slide image, polypore lesion, ectophytic growth, kind of color red. That means this epidermis kind of hugging this spore structure. And then really characteristic big vessel surrounding feeding by this small vessel forming this lobular structure. And then you can see different kind of inflammatory cell, lymphocytes, maybe some plasma cell and neutrophil, but you won't see one population. One entity you always need to bear in your mind, that is, if you find this lobular structure and then everything fits for pyogenic granuloma or this lobular capillary hemangioma, but you find tons of neutrophil around, one diagnosis you need to pay attention is bacillary angiomatosis, which is an infectious disease by Pathology-Li. Usually you can see it in HIV or other kind of immunosuppression patient. So one feature in the clinic that is pyogenic granuloma, you usually just see this single lesion. If bacillary angiomatosis, you will see multiple lesions. Another pyogenic granuloma, the same thing, just ectophytic growth, color red, lobular structure, big vessel feeding by this small vessel around forming this lobular structure. So this pyogenic granuloma.